And I want to take it back to the facilities and the facilities construction and maintenance and my concern. I mentioned the backlog in my opening statement at over $2 billion for the facilities that are currently on the priority list. The total need for construction estimated to be over $14 billion. Your own budget justification indicates that the facilities are roughly 4 times the age of their private sector counterparts. The maintenance backlog is also over $500 million. So I don't understand how, in all good conscience, you can recommend such a significant reduction to this account, over 40%. I guess the question that I would ask is, do we all agree that the maintenance, the construction and maintenance, well, let's start with the construction, that the need is over $14 billion? Is that what we acknowledge? It's a lot.
The answer is affirmative.
Affirmative. And with the backlog also over $500 million.
$569 million for backlog of essential maintenance, alteration, and repair.
And that's over $500 million. So, and that the age of most of the facilities is far in excess of the age of other private sector facilities. So the need, we all acknowledge that the need is clearly there.
Yes.
So is this just, when we look at a reduction to this account as significant as this is, it's a prioritization that we're going to place dollars elsewhere in the budget, and do we have a longer term plan that is perhaps not shared with us about how we're going to address this? What's the plan going forward? Because the need is clearly there, it's clearly established.
Yes, and thank you, Senator. And definitely it's a prioritization of direct health care services and basically kicking the can down the road on expansion, capacity expansion, greater access. We know that our needs will continue to grow, and the $104 to $208 million that we would ideally be putting aside for facilities maintenance, it will end up resulting in the situations like we have at Gallup and in the Great Plains with HVAC systems going down, generating systems going down. So without the additional funding, we can expect to see those problems persist and need to have additional funds, such as through the Accreditation Emergency Fund.
Well, and it seems to me that we know what the answer is here. You've got these facilities in the Great Plains that have just been struggling. You mentioned that you can't get the certification that you need if you can't get the HVAC system up to where it needs to be. And so you spend a lot of money throwing good money after bad with a facility that just it's costing more to maintain to try to get it up to standards. And if you can't get it up to standards, then you're not able to provide the service here. So it just seems to me that there has to be a longer-term plan. When it comes to one of our other accounts, we have jurisdiction over our national parks. Our national parks have a maintenance backlog that is, $11-12 billion, not insignificant. I don't know why we get stuck with all of the maintenance backlog issues that are so significant in this country. I don't know that we should say we're stuck with them, but we're struggling with them. And what we've been trying to do with the secretary there is to figure out, okay, what's the longer term plan? What are the proposals that could help us have a funding stream to address it? But it doesn't seem to me that we have a plan here. And we have been the beneficiary of some good efforts in the state through the likes of the joint venture program that allows the tribes to pay for the construction of new facilities. That has helped us there. But I'm not seeing that we have a strategy. And if we don't have a strategy, I take it back to what Senator Daines challenged us all with, that right now, what is being provided to our Native people around the country is not adequate, and we must do better. So I don't know if you can address what the longer-term strategy is, or whether it's a wish and a prayer that we have more money that comes our way, but you can't have a construction backlog of $14 billion and a maintenance backlog of over $500 million if you're just kind of limping by year to year and hoping that you're going to be able to keep your facilities open.
Thank you, Senator, and want to assure you that we do have very thorough plans, prioritized plans for both our healthcare facilities construction and our backlogs.
Can you get
needs-based.
Can you get to that plan with a 40% reduction in funding?
Not immediately, no, ma'am.
Can you get to it even in the long term? How do you get to it if you're going downwards instead? You're not even holding steady.
Right. It's a
It
growing
doesn't
need.
work.
It's
I
a
think you
growing
just
need.
have to admit it doesn't work. We need to work to address that. But I can't have you defending a 40% reduction and saying, we'll figure it out. We're going to have to address it.